Hi guys, I'm back. For those of you who have been subscribed already and watching my videos, I'm finally back and making more videos. And then for those of you who are new, welcome to my channel. My name is Yasmin, and we're gonna get into it. So for those of you that have watched my videos before, you know that they were all about pregnancy, all about baby, all about preparing for my baby to arrive. But I do want to start doing some nursing videos as well. I am a nurse, and so I want to add those kind of videos to my channel. So if you're interested in those, please subscribe and stay tuned for more videos in the future. And for all my subscribers that are already following my channel, I will continue to still make all the things that you guys want to see. So just leave a comment below, and let's get started. From the title of this video, you know that I'm going to be talking about my first year in nursing. A little bit about me. I am a registered nurse. I became a registered nurse in 2017. So I just passed my 3-year mark of being a nurse this past June or May. When did I pass the NCLEX? I passed it in May, and I started working as a nurse in June of 2017. So a little over 3 years. I started out as a new grad nurse in a pediatric intensive care unit. And then I did a little bit of travel nursing as a PICU nurse. And then after giving birth to Logan, I transitioned into becoming an emergency room trauma nurse in a pediatric hospital. So all pediatrics, I love it. A little bit of ICU and ER experience. So that's a little bit about me. So I did write some things just to talk about so I don't forget on my iPad. So if you see me looking down, that's what I'm looking at. So all my advice can go to any new grad nurse being a nurse for the first time. This is my first year experiences. I have pediatric background, but all the tips should be able to apply to anyone that's a nurse for the first year. If I reference things, it's from my knowledge with my pediatric background, ICU, ER, or just ICU because that's where I started and did my first year. So everything I will be referencing will be from the past because, like I said, I'm in my 3rd year being a nurse. But I can very, very vividly remember my first year as a nurse. So hopefully this helps, but let's just get into it. So RN residency and what to expect. So I started a new grad. I started as a new grad in an RN residency program. So basically, a lot of teaching hospitals across the country have this RN residency program. I would recommend, and I know it's not always possible. I know as a new grad, we're looking for a job, we're looking for what we want to do. We don't really want to settle for anything less than what we want. I understand that. But my recommendation would be to apply to an RN residency program. I think that it really helped me get through my first year. There's a lot of support, a lot of resources. Typically RN residency programs are at a teaching hospital, and teaching hospitals are very acclimated to be able to teach, hence the teaching hospital. So they provide a lot of resources for new grads, a lot of education, a lot of classes that can help kind of navigate through your first year. And personally, my RN residency was everyone in the program's a new grad. People that start on your unit is also in that program. So it's kind of like as well as getting the education in the classes, it's also kind of a way to get to know more closely people that you're working with that's kind of in the same phase that you are. So I know that going into some of the older nurses, more experienced nurses can be a little bit intimidating, but when you have kind of the people that you started with, it definitely helps. So I definitely have built relationships with the people in my residency program that worked in the pediatric ICU with me, and it kind of gave me a level of a comfort just knowing that they're going through the same things that I'm going through. And then within the classes, you do education, you talk about different processes, but a lot of the things that you also is just kind of hearing the experiences and the stories behind everyone else that's going through the same thing. So it definitely helps. We were able to kind of talk about our fears, our struggles, what can we do to help each other, even from different units. Because like I said, you may work on a different unit, but you're probably all experiencing the same things and having the same struggles. So it's kind of like a peer group in a sense. So it's definitely very, very helpful. So I would definitely recommend applying to our RN residency program. It should be specific. It should say residency program application or whatever, new grad residency program. So definitely research that because it definitely really helps. The classes were very beneficial. In my particular hospital, we had building blocks classes. So those, I forget how often we did them, but they basically, in the building blocks, you kind of took a topic and you kind of dissected it and you kind of did scenarios and sims and just kind of talked informational about it. So just say, for instance, we did like a neuro, it was like an, I don't know the exact scenario, but it was all about the neuro system. So we talked about EVDs, which is basically a device that's going to go into your head that's going to drain CSF fluid that we see a lot in the ICU. We talked about increased ICPs, what to expect or what to look for when a patient has an increased ICP, because they're not going to be able to say, hey, my ICP's increased. So you're going to look for signs, which is basically the big thing is the cushion triad, or three things that you're going to see with increased ICPs. So we talked about all those things. We would do a sim and relating to maybe a head injury that came in with a neurological deficit that maybe all of a sudden had increased ICP. Yeah, so that's kind of a little bit about RN residency. But my recommendation is definitely to do it. So if I didn't say that and make that very clear, definitely look into RN residency. So what's next? Personally, why I started into the ICU and what I feel about specializing right away as a new grad. So I started in the ICU. I started in pediatrics because I love kids, and I knew that from the start. Clinicals, personally, I did not like clinicals. I was very honest about that. I just hated going to clinicals, but looking back as a first year and picking something that I wanted to do, clinicals definitely guided me into things that I knew I liked and things that I knew I didn't like. So what things did I like to do? What things I like to see? Did I like the geriatric population? Did I like maternity and mother-baby? Did I like pediatrics? And I knew right away that pediatrics were where I wanted to start. So I actually applied to a nurse extern program, which I definitely recommend as well if you're able to do that, because that kind of dived a little bit deeper into what I would like. So I did the nurse extern program at the hospital that I actually started at as a nurse. And my nurse extern program was ICU rotation. So I rotated for the entire summer through the NICU, the cardiac ICU, and the pediatric ICU. And through those rotations, I realized that I did not like cardiac. I realized that I love NICU, but I didn't know if I just wanted to do NICU. And that's kind of what leaned me towards starting in the ICU. ICU is very fast paced and a lot of critical thinking, not that other places aren't, but that's personally why I wanted something a little bit more upbeat, a little bit more that will allow me to challenge myself and critically think and kind of always anticipate and use my brain in ways that I just didn't want to feel that I wasn't getting enough out of what I was doing. So that's kind of what led me to that. My feelings towards specializing, I am completely fine. I feel like my skill set is beyond anything that I thought that I would be at right now at 3 years into nursing. And if you want to specialize, specialize. Like, I know a lot of times people are like, do med surg and you need to get all your skills. I think that I've gotten all my skills, and I know ICU is critical patients and they have a lot of drains and IVs and ports and chest tubes and can be intubated, have a trach, and do all these things. But my skill set, I have done a lot. I have seen a lot. I have taken care of very sick kids. I have taken care of, in the ICU, kids that are on the transition to transfer out of the ICU, so they're not as sick, but they had the potential to be sick. So I've taken care of just the ones that aren't as sick and can talk now and are walking around and doing things like that. But my skill set is, I'm very pleased with how I am. So I would say if you want to specialize and you know what you want from the door, just do it. How I felt my first day versus how I felt at my 1 year mark. So my first day as a nurse, I was terrified. I was absolutely terrified. I had no idea what to expect. I knew the kids were sick. I remember walking down the hallways and like looking into different rooms and seeing like all these tubes and pumps and lines and someone on the vent. And my second day, unfortunately, I did actually do post-mortem care. So my second day as a nurse, I did post-mortem care because the patient had passed away, very, very sick. I seen ECMO get put up and in an emergency, and very, very, very terrifying. And I remember going home that day and I cried because I was like, what did I get myself into? And I know sometimes you're gonna say that, and you are, trust me, you're gonna question yourself probably every day for the first 6 months. And that was me. I questioned myself every day for the first 6 months, like, why did I do this? I don't think I'm meant for this. I don't know why I did ICU. The kids are making me so sad. I'm crying all the time. Like, it was a mess. And that's and I remember talking to my supervisor about it, like, this is not for me. I need to get out of here. I need to go to a different floor. Like, I want to do something else. And she's just like, stick with it. This happens to everyone. Like, just keep going. She was like, you're doing amazing. Like, it's not gonna get better. Like, this is not gonna get better. But it does. Trust me, it does. And the 6 month mark was about where I felt comfortable, I would say. I still would come to work or, like, have the like feelings like, oh, I have work today. Like, I cannot do this. Driving to work, I commuted an hour. So I had an hour of dreadfulness of like, should I turn around right now? But the 6 month mark was definitely where I got a little bit more comfortable. Like, I could definitely go from taking care of like a semi-sick to like a sick, intubated, but stable kid and like feel okay. I was like not really feeling like I couldn't do this anymore. Like, I was getting through my shift and getting everything done and felt good about myself. So definitely 6 months, I would say, get to the 6 months. After 6 months, if you're like, I would say after the year. If after the year, you're like, this is not for me, I can't do it, then give yourself a chance to like branch out and do something else. You have a year experience as a nurse and you can do something else. So I would say get to your first year mark. But I definitely felt more comfortable day by day. So yeah, those feelings are normal. Crying, normal. All that stuff is normal. So don't feel like don't beat yourself up about it. I definitely beat myself up about it. So don't do that. You'll be fine. You're gonna get through. We're all gonna get through it. Listen, if you got through nursing school, you're gonna get through this. Trust me, nursing school was like, how nursing school was. So if you got through nursing school, you're gonna get through this. You're gonna be fine. So day 1 to like my year, how I stayed organized. The PICU is like, if you don't know, PICU is documentation galore. You're gonna document everything. And you're gonna be very tedious, you're gonna be very organized. It's just gonna help you get through your day. So I remember going in my first day and listening to report, and I was like, yeah, I have no idea what they're talking about. No idea what they're talking about. They're saying things that I'm like, I don't know what that is. They're using abbreviations. They're using all these like PICU, ICU terms. They're saying vet settings and pressure support and all these things. And I'm like, I don't know what that is. I was just standing there like, and I know we all have that moment where we're like, yeah, I've never heard that before. I've never seen that before. And I always would talk to my parents like, I don't know what they were saying. Like, I don't know. I was just like so confused. And then like at my 1 year mark, I was given a report, and I remember giving a report to like a newer nurse on orientation, and I was just like rambling off all these things. And I remember like looking back and like, kind of laughing like, wow, I did not think that I was gonna be here today, because I just had no idea what anyone was saying before. But now I'm the one saying all these abbreviations and talking ICU and giving report in ways that I was like, wow, I've grown so much over the past year. And that's how you're gonna feel. So you might not know it the first day or the first week or the first month, but you're gonna know, you're gonna get to it. And in a year, you're gonna look back and you're gonna be talking to a nurse that's more new than you, or a brand new nurse that's on their first day, and you're gonna be talking to them and helping them. You might not know everything, but it'll get better. But to stay organized, for me, just to kind of go back, I don't know if I totally answered the question. I would get there about 30 minutes early from my shift. And that was something that they made it very clear that we could do as a new grad. And I would look through the patient's chart. I would write down like my, we had little cards, card X's that had like each time. And it was kind of like I don't know what the word, like a planner that went hour by hour. And then we had like systems. So I would like kind of write down like their history. I would write down like when their meds were due, what meds they were getting, when labs were due, and like look through the orders and write down all that stuff. And just kind of look through the chart, look through the progress note, look through the doctor's note for the day, just to kind of get an idea of what I was kind of getting myself into. That way, when I was getting a report, it was a little bit more easier for me to understand, and I kind of would know what questions to ask. So like if the med say was overdue and it wasn't given at 5 a.m. and now we're coming on at 7, I would write that down, because I want to make sure that it's addressed why the med wasn't given. Did they want to hold it? Did they give it and just not sign it out? Because then I want to make sure they sign it out. Or was it held for say 8 o'clock and now I have to give it at 8, and say the nurse forgot to mention it? At least I look back and I know, so that I can, address the question. So kind of prepare myself in that way, which definitely is very helpful. So if you're able to do that, I would say get there 30 minutes early, 20 minutes early, whatever you can, kind of get through the patient's chart, get yourself settled. So you don't feel rushed in the morning, because rounds happen in the morning in ICU world. So when you are finally getting yourself settled and you barely got things started, you have a million meds to give, and then all of a sudden the doctors come over to round. Now you're going to be all behind, and then it's going to make you more stressed, and then you're going to be overwhelmed, and you're going to feel like you're drowning, and that's not the feelings you want to feel, especially as a new grad. So just tips that I've learned throughout my first year that I just want you to know. Nursing school does not prepare you. And I know I'm saying that very loosely. You get the knowledge, you get like the nursing system, the nursing assessment, things like that. You get to kind of get your feet in the door with like going to different hospitals for clinical. You definitely get the broad knowledge of nursing, which is helpful, because you wouldn't be able to be a nurse without going through nursing school and passing your NCLEX. But there's a lot more that I learned on the unit than I did in nursing school. Like, you're gonna learn things specific to your unit. I felt like I knew nothing as a new grad. I was like, I don't know anything. I felt it was very intimidating, because there was nurses that felt like I felt like knew everything. That just comes with time, because they've been practicing a lot longer than you have. But you know your basic knowledge. If you didn't pass the NCLEX, if you didn't pass nursing school, you would not be a nurse. So be confident in that. That's what I would say, is just be confident in it. But you're gonna learn day by day, and you're gonna know. I know so much more as a nurse in 3 years than I did when I was a first year nurse. But with that being said, I would ask a lot of questions. It's okay to ask questions. Do not be afraid to ask questions. No question is stupid. And I know you hear that a lot, but that is like the epitome of how I got through. I would ask questions on everything. If I wasn't clear about something, I would ask. If I didn't know how to do something or know something as to why something happened, I would ask. And if I didn't ask, I would look it up. And if I was confused about what I found looking it up, I would ask the question, because that is what's gonna help you. If you ask, you're now gonna know for the next time, or you're gonna know that my kid has low blood pressure. I'm not gonna give Versed. I'm gonna ask the doctor to clarify if they want me to give it, if they want me to hold it, because my blood pressure is low, and that lowers your blood pressure even more. So I'm gonna ask that question, right? So I would just make sure you ask. And if you're not clear, if there's an order that you're not clear about, if there's an order that you're like questioning, like, is this dose too high? Is this right for this patient? This medication just seems like I shouldn't be giving this. This kid has no fluid retention at all and I'm giving a diuretic. Why? Sometimes you get, oh crap, I ordered that for the wrong patient. Sometimes you get, oh, I talked to so-and-so from this service and they want to trial this medication for this patient. Can you give it? Sometimes you get, oh, we're giving a higher dose to see if that helps. Whatever the case may be, sometimes you need, but you can ask. And then what I do is I write a note. So I write notes about everything. I wrote notes about everything. Just because it covers yourself. So if you are like, you know what, I don't know about this, let me write a note that the doctor, the resident, whoever said okay for me to give med, okay for me to hold med, because if something happens, at least you said that you contacted the doctor told you this, and that's why I'm doing it. Sometimes I would let other nurses intimidate me or feel like that, why did you ask that? You should know that. Like, I didn't know that, and that's why I asked the question, and it should be okay for me to ask the question. So if you feel some type of way about asking a question, just ask it and say, who cares, because it's helping me and I'm just making sure that I'm safe and it's for the betterment of the patient. So time management and prioritizing, huge in the ICU world, and probably huge in any nursing world, in any unit at that, but definitely the ICU world. Time management, that's why we have our little Cardexes. So if you don't have one on your unit, you can go on like Google and like type in like hourly planner or nursing Cardexes or whatever the case may be, and kind of just plan out your day hour by hour, especially when you're inpatient. You can write down hour by hour. If something comes up in rounds, you can then cross it out and write down the new plan for the day from rounds on. But I did everything from meds, if they were due at 8, 12, and 4, labs at 4, were typically 4 and 4 a.m., 4 p.m. So I would write down my labs and when they were due. I would write down like mouth care, turning, because sometimes you just forget. So I would just write it down, and you can just say turn patient, and then that way when it's done I would cross it out, and that way I knew everything for the hour was done. If it was giving a bed bath, if it was doing OR checklist, if it was doing CHG wipes, or whatever the case may be, I would write it down in the hour that it needed to be done, and I would do that. IV check. I know IV check is every hour, but I would write it down as a new nurse so that I knew that I wouldn't forget it. Because if it's written down and I see it, then I'm not gonna forget it. So even the little things like an IV check, you just go in, you look at the IV, you feel all that things, and then once it's done, you cross it out. And I would cross it out only after documenting it. So if I never documented it, then I wouldn't cross it out, because then if I cross it out and I forget to document it, then it kind of, you didn't do it. If it's not documented, you didn't do it. And that's kind of the motto. So once I documented it in Epic, I would just cross it out. Prioritizing, it was a growing thing that I kind of learned on the go. And just kind of understanding like some things aren't as important as other things. So there could be a million things due in an hour, but I would make sure that I do the things that were more important first. If your patient is crashing, then giving scheduled meds is not important. Like if you're due for all these meds and you're like, I have all these meds to give, like whatever. If your patient is crashing, they're not gonna be here for you to be able to give the scheduled meds. So you need to do the thing that's more important first, and then you can come back. Definitely got better prioritizing, but just kind of, you know, and I would always ask the question to my preceptor. If I had like 5 tasks, just say I had 5 tasks for the hour of 7 o'clock. I have 5 tasks to do. I would always ask her like, what would you do first? And that's kind of things that kind of got me to knowing, and then she would tell me and explain why. So she would say, you know, I would do this first because this is just more important, or they need this medication, or they're very sensitive to not getting this medication on time, or whatever the case may be. So she would kind of tell me what her thought process was, and that's kind of how I learned to be able to prioritize. If we had 2 patients, ICU, we typically have a 2-to-1 or a 1-to-1 ratio. So if we had 2 patients, I would always say, what patient would you go in and assess first? Because one patient out of the 2 might be a little bit sicker, or might be a little bit more unstable than the other. So I would always ask like, hey, what patient would you assess first? And she would tell me. And that's kind of how I learned that as well. So you kind of just go, it kind of gets better over time, but definitely ask the question. Boom, boom. Ask the question, and don't be afraid to, because their experience is gonna help you grow as a nurse. Ask for help. Why do you ask for help? Because you're gonna need help. Don't think that you can do everything on your own, because you cannot. And I know you wanna feel like you're like the best nurse ever and you got this and all these things, but like I still ask for help as a nurse, and I've been a nurse for 3 years. Like if I have a million things to do and there's somebody that has the time to be able to help, even if it's just to give one med or hang one IV med or one IV fluids, or just to assess a line, or just to assess and document urine output or chest tube drainage or whatever, like I ask for help. And if they can't, they can't. Like if they say, hey, I got a lot of things that I have to do with my patient, I can't, then that's okay, but you at least put it out there that you can ask for help. We had CNAs on our floor, we had transport techs, and we had a bunch of things that we could use. So if I needed to get a pump and just say new bedding and whatever else, like I would call one of the techs, hey, can you grab me a new pump, a new IV pole, bedding for my sheet, and bring it to room 5. And they might not be doing anything, and they can do those things. That's why they're there. They have their things in their scope of practice that they are able to do, and you just need to be aware of what techs can do, what respiratory therapists can do, like whatever it could be. You just need to be aware of what they can do, so that you can ask for help, because that's why they're there. They have a job just like you have a job. Just ask for help. Don't feel like you need to drown, because you don't need to drown. There's a whole unit of people that can help you. So don't feel like you need to just drown in your work, and just because once you are drowning, it's hard to come back up. And even as an experienced nurse, I still drown sometimes. But if I can avoid it, like that's what I want to do, is avoid it. And then kind of the last thing is just know how you learn. I'm a very visual learner, and I'm a very hands-on learner. So I need to be like, I need to see it first. So you can talk about it, but talking about it or reading like a policy doesn't really help me in the sense. Seeing someone else do it, so seeing my preceptor do something, maybe for the first time or the second time, definitely helps, and kind of talking me through it, and then me actually being hands-on and doing it definitely helps. That's how I learned. So that's things that I told my preceptor up front, like, hey, the way I learn best is to watch you do it, and then for me to be able to do it, and then get feedback or whatever. I would definitely take charge of your orientation. I know that might be a little, let me just explain it. What I mean by that is like, I would have 2 preceptors. So like, one preceptor, I would see like maybe that day I did like everything in the world. They had all these drains, they had this, they had all these meds, they had IV meds and piggybacks and all these things that I did, right? So I would do them, and I would feel comfortable with doing them by the end of the shift. But then say the next shift, I would have like my secondary preceptor who would come in, and she wouldn't know what I had learned the day before, or she wouldn't know that I already knew how to do a piggyback, or I already knew how to hang just like a simple med setup. Like she wouldn't know that because she wasn't there the day before. So instead of just kind of like being to myself and just kind of letting her just kind of take charge and just do things herself and teach me, I would just speak up and say, hey, like me and so-and-so did this yesterday. Do you mind if I do it? Like I already kind of, you know how I do it. Do you mind just letting me do it and kind of giving me feedback? And she was like, oh yeah, but she wouldn't know if I didn't speak up. So I would just speak up and tell you, because you're not always gonna have the same preceptor. You speak up and say, I've already done this. I feel comfortable with this. Do you mind if I just do it? So definitely do that. And if you need more time, like I have people that started with me. I think we started with 10 new grads. I got off orientation and a couple other people got off orientation, but some people were still on orientation for another week or two because they asked for more time. If you don't feel comfortable to come off orientation, ask for another week or two, because ultimately it's for the safety of the patient. And if you don't feel like you're ready to be off on your own, then just ask. You never got a lot of arterial lines. Like, you never got one, and you know, as soon as you get off orientation, the things that you never got, of course, you're probably gonna get, because that's just how it works in the nursing world. So if you've never experienced taking care of an arterial line, ask for it. Like, say, hey, I've never done this, and that's why we had checklists of things. So we had like a booklet of things, and we would just mark it off as we got to do it or learn about it. That way we knew things that we still needed to see or things we still needed to do. So that way your preceptor knows, like, hey, if anyone has an arterial line today, can me and my patient come see it, come draw labs off it, come do whatever. That way you're able to get that experience. But if you don't speak up of things that you want to learn more about or you want to be able to do, they're not going to know. And then that's going to ultimately make it even more terrifying when you see it for the first time when you're off orientation. So definitely speak up in that sense. You control how much you learn. You control like how much you get out of orientation, how much you get out of your first year. Like, put in the effort, and trust me, you'll see the benefits. Like, you definitely will, and you'll definitely feel more comfortable with taking care of patients and sick patients and things that you know, just new things that you'll see. But just be confident in that, and just know that you got this far and you can do it. So those are my thoughts. I hope all those tips help. I hope I wasn't rambling all over the place. If I forgot anything, if you have any questions about my first year, about PICU experience, about pediatric experience, things like that, leave a comment below. Let me know. If things that I didn't address that you just have questions about, definitely leave a message below. Or comment below. You can also comment, subscribe, hit that like button, hit the notification button so you know when I update more videos, upload more videos. And thank you for watching.